everyone for being here today. My name is Tina Early. I am the president of the YWCA Union County Board of Directors. I appreciate everyone being here today to hear our Stand Against Racism program. The YWCA's mission is eliminating racism and empowering women. We know that these elements are intersectional. We cannot do one without the other. The challenge of racism and hate has been exposed during the pandemic and is more important than ever. We have seen economic disparities getting wider, affecting Black and Brown communities disproportionately, and we've witnessed hate directed towards Asian communities increase. What the pandemic has also revealed is that racism is a public health issue that cannot be ignored. It was there before the pandemic, but the crisis laid bare the inequities that were already in place. Today, we bring together experts that bring varying perspectives to this conversation, highlighting the challenges and paving the way towards solutions. Stand Against Racism is a program of YWCAs across the United States. YWCA affiliates are having similar conversations in their communities to bring awareness to these issues and begin the path toward change. It's our hope that each of you learn from this discussion and bring your takeaways to your own communities. I'd like to introduce our keynote speaker, Dr. Pamela Brug. Dr. Brug is a board-certified obstetrician gynecologist in New Jersey and is affiliated with Hackensack Meridian Health Raritan Bay Medical Center and Hackensack University Medical Center. She received her medical degree from Rutgers Robert Wood Johnson Medical School and has been in practice for more than 20 years. Dr. Brug is also on faculty of Rutgers University Robert Wood Johnson Medical School in the Department of Obstetrics, Gynecology, and Reproductive Sciences. Her interest in disparities in healthcare has led her to address Black maternal and infant morbidity and mortality, especially in New Jersey. She also serves as the vice president of the New Jersey Black Women Physicians Association. Please welcome Dr. Pamela Brug.
Thank you so much for having me here to speak on this most important issue in regards to the impact of racism to Black lives, living, and wellness. My slides, please. Even though I am speaking on maternal health, I could have chosen numerous aspects of health, including a number of diseases, such as hypertension, diabetes, kidney, liver disease, to oncology, from breast to colon to prostate cancer. I also could have spoken about the social determinants of health and racism. I could have spoken about the impact of racism in education, including medical education, just to name a few. But as I am an obstetrician, I am speaking in regards to maternal health because that is a public health crisis that exists in my professional lives and the lives of many. Next slide. I think we have to begin with definitions. The definition that I utilize most of the time in giving these talks is that racism is a system of social structures that provides or denies access, safety, resources, and power based on race categories, and produces and reproduces race-based inequities. It basically affects us individually as a community, and it's built into our institutions and in our fabric of our culture. Next slide. Though it's a system, it has many manifestations. And the discussion in this talk will deal with the institutional and interpersonal relations that actually lead to health disparities. as various institutions in society, their policies and practices that perpetuate a cycle of racial inequities and promote such things that have occurred historically and still are occurring, such as redlining, food deserts, stop and frisk, and interpersonal manifestations that lead to macro and micro aggressions or social exclusions or assumptions about people. Next slide. So due to this systemic racism and manifestations that relate to the interpersonal effects, we have now National Minority Health Month, a month-long initiative to advance health equity across the country on behalf of all racial and ethnic minorities. And this week happens to be the 4th annual National Black Maternal Health Week, which is held annually on April 11th through the 17th each year. It was founded and led by Black Mamas Matter Alliance in order to introduce a week of awareness, activism, and community building intended to deepen the national conversation about Black maternal health in the United States. Next slide, please. And the reason we need these types of weeks and months is because of the news that we have noted over the past few years, but are not new news to us. The shame on us for allowing maternal death rates to soar. Why are Americans, Black mothers and babies are in a life or death crisis? There are considerable racial disparities in maternal deaths. Next slide. When we use the term disparity, it basically states that there is an unjust difference. And nationally, Black and Indigenous women are 2 to 3 times more likely to die of pregnancy-related causes than white women. And this is irregardless of socioeconomic status. So neither in education or money makes a difference. Of course, the well-known case that had been in the news was on Serena Williams, who complained numerous times in regards to her not feeling well, and that she felt that she was forming clots and she was not heard or taken seriously. Finally, a physician looked into her complaints and found that she had several blood clots. But we can all imagine if that physician had not stepped in when he did, after so many complaints that she had in regards to her symptoms, we would not be having her play at this time anymore. Next slide. In the United States, about 700 women die from pregnancy-related complications. This data from the CDC Pregnancy Mortality Surveillance System. It is the most accurate source of national data on pregnancy-related deaths. All these women are dying during a period of time when we would think that they would have the most support in the healthcare system, but also in their communities. But there are people behind these numbers. There are families that are affected by this. From the PEDS resident who died days after birth, giving birth from preeclampsia complication, a high blood pressure disorder during pregnancy, which Black women develop at a rate that is 60% higher than that of white women. And if they develop it, it is more severe than those than when a white woman develops preeclampsia. And the thought behind it is that because of the chronic stress on the body that occurs from racism in the United States, it causes changes in our bodies, including blood pressure effects. There's also the mother-to-be whose breathing problems were blamed on her obesity over and over and over again, when in fact her lungs were filling with fluid and her heart was failing her. To the businesswoman with a high-risk pregnancy who was so upset at her doctor's attitude that she stopped going to her visits in her third trimester, which are the last couple of months of her pregnancy. And as she attempted to change her doctor, she suffered a fatal stroke. So these stories impact on families as we have shown, as the next slide will demonstrate, that there has been no improvement in our pregnancy-related mortality rates. You can show the next slide. The United States, is the worst in the industrialized world because of the fact that we have such a high rate of Black maternal mortality, despite the technology and other advances in medical care. Next slide. And now let's talk about New Jersey. New Jersey being in the top 10 richest states in the nation, has the 47th worst maternal health indicators, including maternal morbidity, in which 60% of those deaths are preventable. Next slide. As seen here, from 2014 to 16, Black women in New Jersey died at a rate 7 times their counter-white mothers. Again, I must stress, this is regardless of socioeconomic status. It has been shown over and over again that racism has a hand in this, as Black women are discounted, not believed, not trusted in the information that they give to healthcare providers, healthcare staff members, and then develop disorders that can lead to their unfortunate early demise. Next slide. But the impact is not just on the death rate. There are near misses. There's severe maternal morbidity, meaning severe illnesses. There are illnesses that again lead to hospitalizations, emergency room visits, and continued doctor visits over and over again. The idea is to eliminate the preventable maternal deaths while assessing all the other cascading events that occur before one reaches the outcome of a death. Next slide, please. But I want to also highlight 2020, the pandemic, which, as stated, has brought into the media the disparities that have existed for so long and then continue to exist within the environment of COVID-19. Next slide. I want to give some background information. Most women who get COVID-19 are what we call asymptomatic. They don't have any symptoms that are related to the disease themselves. However, if one is pregnant, you are at increased risk of actually getting severe symptoms that can lead to hospitalizations, therefore ICU admissions, therefore at risk of being placed on a ventilator, and therefore increased risk of death. There's also been shown that when one is pregnant and has COVID-19, you are at risk of having a preterm delivery. Next slide. But even though Black women are at increased risk of having COVID-19, it has nothing to do with their race. It has to do with their risk of exposure. So anyone, your risk of getting COVID-19 has to do with your risk of exposure. So what are the risks that a Black woman in New Jersey, but throughout the nation has, that increases their risk of exposure? It starts from jobs and occupations. So those jobs that are not, you are not able to work from home, you have to leave your house, are in many times are predominantly filled with many women of color who are then placed at high risk situations, from childcare, food services, nursing, even teaching, environmental services, transit workers, manufacturing. Also the use of public transportation. Also housing situations, in particular, multi-generational homes. The severity of the disease is related to comorbidities that are found within communities of color, such as diabetes, hypertension, and obesity, that actually makes one at risk of getting more severe complications of the disease. Next slide. And in New Jersey, as we can see, the impact of race and ethnicity has shown again that the burden of COVID-19 in deaths, in hospitalization, and severe outcomes has been placed on the Black and Latinx communities compared to their white and Asian communities. Black and Hispanic pregnant women in Philadelphia, for example, were 5 times as likely as white and Asian women to have been exposed and been infected with the novel coronavirus known as COVID-19. And this heightened vulnerability of pregnant women to stressors in general, including the pandemic-related stressors, not just the health, but the social and economic stressors, are of a special concern, as we know that these stressors in pregnancy can lead to adverse outcomes, such as preterm deliveries, which already was known to be higher in Blacks than other races. Research has shown that the impact of racism on pregnancy of Black women results in stresses producing hormones, resulting in the onset of labor at early gestation, meaning a preterm delivery occurring before 37 weeks. Now we have added on the pandemic, where there is already an increased rate of preterm delivery in symptomatic COVID positive patients. And we have racial injustice in the forefront, or also adding onto the already known increased preterm delivery rate in Black women. Next slide. The discussion of unequal treatment, the knowledge of long suffered poor communication within the healthcare profession, this has been noted since way before this even was published in 2003 as a unequal treatment confronting racial and ethnic disparities in the healthcare system. Despite these findings in the social sciences of these disparities, we continued in the medical field to have persistent racial stereotypes, and that impacted treatment day in and day out. From pain management to discounting of symptoms to survival of oneself in maternal health to the survival of your newborn that has been noted in a study that came out this year, past year, where your survival of your baby was impacted by the race of the physician that took care of your baby if your baby was born and placed in a NICU, a neo-intensive care unit, usually reserved for preterm infants or infants that have other complications. So now we know the rate of preterm delivery is high in Black women, and their infants are now placed in NICU environments where their survival is dependent on the color of the doctor who's taking care of them. And the more severe the complications, the more it was important that the doctor for a Black infant was a Black physician. This cannot be. The survival of an infant cannot be dependent on the color of the skin of the doctor who's taking care of them. Next slide. Martin Luther King stated that our lives begin to end the day we become silent about things that matter. In the end, we will remember not the words of our enemies, but the silence of our friends. And silence in the healthcare community and the community at large leads to a comfort zone of complacency and complicity. But most importantly, it leads to distrust, anger, and apathy within the community affected. It is imperative that we reset on racism and that we agree it is not acceptable and guard against it, continuing to spill over in the way we treat and care for patients in the healthcare system. Now we have gone from the CDC not addressing to finally just making the safe statement that racism is a public health issue. Finally, in 2021. Next slide. But we need not just at the CDC, but for healthcare organizations, institutions, teams, communities, and individuals to acknowledge that racism exists. The healthcare community must engage in the hard work required to address internally and externally one of America's most prevalent silent killers, racism. As per Dr. Leslie Farrington, an OBGYN and co-founder of the Black Coalition for Safe Motherhood, it is time for medical professionals and professional organizations to re-educate themselves, to recognize and eliminate racism, patriarchy, and elitism in medicine so all women can experience safe and effective and respectful maternity care, and we can close the shameful disparity in maternal deaths. Next slide, please. The question is, how do we do this? As noted by Professor of History, Dr. Ibram Kendi, there is no neutrality in the racism struggle. One either allows racial inequities to persevere as a racist or confronts racial inequities as an anti-racist. There is not an in-between safe space of not racist. The claim of not racist neutrality is a mask for racism. The medical profession and associated institutions and organizations must realize that there is no such thing as being not racist and create anti-racist environments, education, and policies, all for our common goal for healthy patient, physician, and other healthcare workers, such as our nurses, midwives, doulas, and assistants in the field of OBGYN, but also throughout the medical field. Next slide. The New Jersey Black Women Physicians Association believes that all efforts must include ongoing mandatory state, institutional, and department level anti-racism education to enable self-reflection, recognition of racism, and understanding of the expectations that the organization has in accordance with their mission, vision, and values that support anti-racism. 2, individuals can also begin with themselves by exploring their own biases, acknowledging them, and dismantling them. 3, anti-racist policies that guide organizations in the creation of a safe place for all employees. Establish a fair and measurable process for evaluation, promotion, salaries, and growth, supporting people managers in their efforts to counsel, educate, and manage their employees that are unable or unwilling to remain within the guidelines for no tolerance policy on racism. Apply an anti-racist equity lens to every decision that's made and seek out structured tools to help you do this consistently and with accountability, as suggested by Dr. Chris E. Foster and others in the January's Annals of Family Medicine article entitled Dear White People. 4, externally, all our organizations have open door policies to engage stakeholders, including their community, their leaders, faith-based and community partners and healthcare workers in ongoing dialogue. What are the needs? What are their healthcare experiences? What do they feel would make them come back if they had another option? We must be creative in order to obtain this information, and we must have a pulse on the communities that we serve and the impact of any policies that have been implemented. And 5, to support and value researchers on the ongoing understanding of this disease and killer known as racism, with not only money, but also time, mentoring, and expertise support, along with the consideration of adding racism in study design, analysis, and reporting. The tools are simple in many ways, but the work is difficult and often painful. The acknowledgement, education, respect, collaboration, common goals, excellent patient-centric care and experience, rewarding of healthcare system in doing this, ongoing building of trusting and resilient relationship. But most important right now is to believe Black women. Next slide. As such, we began this year our campaign and initiative, Believing the Black Women in Our State, and forming partnership to get this campaign so that people understand, organizations understand that it starts with all of us to lead the way in the destruction of the racial disparity that exists for maternal deaths in this state, but also this nation. Thank you for including me in this most important discussion and topic.
Thank you, Dr. Burr, for that information and sharing. Definitely some information in there for us as we continue to not be silent about the things that matter. My name is Aretha Johnson, and I serve as the Vice President of the YWCA of Union County Board of Directors. It's my pleasure to moderate this session this afternoon, and I'm going to introduce you to the distinguished panel that we have joining us today. I would first like to introduce Bryan Baugh, MD. He's the Global Medical Affairs Leader for infectious disease and vaccines for Janssen Pharmaceuticals. Dr. Baugh is the Global Medical Affairs Leader for infectious disease and vaccines of Janssen Pharmaceutical Companies of Johnson & Johnson. Bryan primarily is responsibility is to support the research and development of clinical affairs strategies for HIV and vaccines. Prior to joining J&J, Bryan practiced in Washington, D.C. and was the director of HIV services, staff physician at the Whitman Walker Clinic in Washington, D.C. Bryan earned his BS in chemistry from the Howard University, his medical degree from Medical College of Ohio, and trained in internal medicine at the Washington Hospital Center. Welcome and good afternoon.
Thank you.
Linda Flores-Tober, Executive Director of Elizabeth Coalition to House the Homeless, a longtime resident of Elizabeth, New Jersey. Linda's local knowledge has been invaluable in her 29 years at the coalition. As a graduate from the College of St. Elizabeth, she has also been the agency's coordinator for the First Friends Visitation Ministry and administrator at the Bridgeton Nursing Center. She was honored as the Humanitarian of the Year in 2008 by the College of St. Elizabeth and awarded the Outstanding Women's Leadership Award by the New Jersey United Nations Association in 2004. Linda was also awarded Hannah Caldwell Award for Achievements in Social Services by the Snyder Academy of Elizabethtown and the Old First Historic Trust in 2017. Linda has been a co-chair and now chair of the Union County Comprehensive Emergency Assistance System and Care Committee since 2012. She's part of the Union County Homeless Trust Committee, the Human Services Advisory Council, and the Union County Freeholders Task Force on Foreclosure. The coalition was recognized in 2013 with the Union County Unity Award and in 2010. Linda was awarded the Bank of America's Local Hero Honor for her work with the homeless in Union County. Welcome this afternoon, Linda. Kathleen Dolan, Local Group Lead, Mom Demands Action. Kathleen has been a resident of New Providence in Union County for 30 years. She recently retired from a career in pharmaceutical industry. She and her husband, Ted, raised 3 children, and after the Parkland shooting in 2018, she was motivated to join the Moms Demand Action organization, realizing how much still needs to be done to end gun violence in this country. She is the Mom Demand Action local group lead for Union County. Welcome, Kathleen.
Thank you.
Cassandra Gibson, President and CEO of Caring is Mutual LLC. Sandy is the President and CEO of Caring is Mutual LLC. serving as a dedicated, trusted advisor and an industry influencer who passionately advocates on behalf of her clients. Sandy is a seasoned expert in the insurance industry who truly understands the issues that are important to consumer and businesses in New Jersey. With over 25 years of experience in the health industry, Sandy was named president of the New Jersey Association of Health Underwriters, a statewide consumer and employer group advocacy organization of over 600 plus professionals who are dedicated to educating the public on critical health issues, shaping health insurance legislation, and raising the ethical standards of the business. Welcome. Now I
Thank
will
you,
have
Aretha.
our panelists give us a few opening remarks. Dr. Bryan, you want to start us off?
Sure. First, I want to thank everyone for having me here. This is a wonderful panel discussion in addition to the topic that was presented by Dr. Brug. I found it very informative and I learned a lot. As it was said in my introduction, I'm a physician. I've been here in New Jersey now for about 14 years, and I initially practiced in Washington, D.C. at a large HIV clinic. I currently am the Global Medical Affairs Leader in Infectious Diseases and Vaccines. And I'm here really representing kind of my work and my interest in health inequities and disparities amongst different communities. And so I have to give the public disclaimer that I'm not here to talk about product or anything that we have in development, but more so around the topic of, race as a public health issue. I will say that many of the topics that Dr. Brug touched upon are things that I've really been ruminating over lately to really wrap my head around and understand. And I think we're slowly making progress, especially with the CDC recently stating that we should consider racism as a public health threat. And I'm just excited to be here and I welcome the discussion.
Thank you. Linda? You're on mute. Linda, you're on mute.
Linda, you're mute. There you go. Thank you so much for inviting me on this panel. I feel very honored. The issue of housing is underpinning all of this, in that without safe, decent, and affordable housing, no one can achieve any kind of health. And so what we advocate for is for vibrant, diverse communities. And as you well know, people of color are regularly, in fact, as the Urban Institute has illustrated recently, are redlined out of white communities and suburban communities, and they are often denied opportunities to purchase housing. And I can cite all kinds of things, but I think that the shelter force drew a straight line from housing to healthcare. And that if you don't have adequate housing, if you don't have safe housing, then you cannot have adequate healthcare.
Kathleen?
Hi, thanks so much for inviting me to join this esteemed panel. I'm representing the Union County chapter of Moms Demand Action for Gun Sense in America. And if you're not familiar with that organization, we're a grassroots movement fighting for public safety measures that protect people from gun violence. We have a chapter in every state, and our movement includes over 6 million supporters nationwide. It was founded by Shannon Watts, who was a mom who was outraged after the 2012 Sandy Hook shooting, and started a Facebook group that grew into a national grassroots movement. We've been successful in combating the gun lobby by advocating for stronger gun laws and closing the loopholes that jeopardize the safety of our communities. We also work with local community partners to encourage a culture of responsible gun ownership. We're very pleased to be a community partner with the Union County YWCA. A couple of years ago, we collaborated on an event where attendees learned what domestic abuse victims face when trying to find their way out of their situation. And it was really eye-opening for many of us. I'm really committed to supporting the YWCA in any way we can, as this group sees the impact of gun violence firsthand every day. We really must, Dr. Brug was absolutely right, we must continue to work across all races, creeds, genders, classes, industries, systems, to make meaningful changes. And we just have to keep going. We will get there. Thanks. I look forward to today's discussion.
Thank you. Sandy?
Good afternoon, all. Thank you again, YWCA of Union, for coordinating this excellent, informative event. I look forward to participating on this distinguished panel, and let's get the questions going.
Great, thank you, guys. So we had some questions that were submitted prior, so we'll go through those questions first, and then we'll check to see if there was questions in the chat, and we can get to those. So let's just get started. I'll just jump in. So I'll propose the question, and whoever feels led to, want to kick us off, then we'll just do it. So it's no particular order. So the first question that we had submitted was, have we made any progress in the last decade in your particular area, statewide, countrywide?
Yes, I'll take that one first. Considering that, again, I'm in the health insurance industry, the first thing that comes to mind over the last decade is the Affordable Care Act, probably affectionately known to most people as Obamacare. It was implemented March 23rd of 2010. What it did was say that 10 essential benefits must be in every insurance policy to, again, ensure that pediatric dental is being covered, to ensure that pre-existing clauses are no longer part of medical plans, which is huge, because if you had the unfortunate disease of getting cancer, should you later on, when you're in remission and recover, pay a higher premium because, again, you had the unfortunate situation of getting cancer 10 years ago? Also, the expansion of Medicare has Medicaid in 2014 was huge because, again, it helped low-income households obtain more financial assistance when purchasing health coverage. Now, I know I mentioned Medicaid expansion. Some people get Medicaid and Medicare confused. Again, Medicaid is assistance with health costs for low-income consumers, and again, Medicare is for 65 or older consumers. And last but certainly not least, I would be remiss if I did not state that effective January 1st, 2021, the state of New Jersey embarked upon our own state-based exchange called Get Covered New Jersey. For the first time, New Jersey residents, families, individual consumers, or small employer groups with 2 to 50 employees can purchase health coverage or dental coverage directly, again, through New Jersey's own state-based exchange called Get Covered New Jersey. And shameless plug for myself, because I am a broker, and again, we do sell health coverage. As you can see in the back, my company is Caring is Mutual, LLC. So if anybody needs assistance navigating through Get Covered New Jersey or assistance purchasing health coverage outside of Get Covered New Jersey through a private insurance company, we're here to assist with that as well.
If possible, I'd also like to make a comment about HIV. You know, we often don't think about the advances that we've made in HIV therapy. If you remember back, you know, I remember when I was in residency, I had patients who would come in through the emergency room, and in a short period of time, you know, they wouldn't even be alive to make their follow-up visits. It's an area where we've been able to come up with better therapies that are more tolerable, fix those combinations, meaning that pills are contained, multiple medications are within one pill in order to ease the use for patients. We've seen infections rates decrease in different demographics, but an area where we still struggle is African-American patients, Latino, Hispanic communities, in addition to women of color. Although the rates have fallen slightly, when we look at the demographic trends over the course of time, we still see that over half of the infections occur in African-Americans. And when we look at women, in particular women of color, they're disproportionately affected. You can also look at it from a geographical standpoint. And if you look at the infection rates in the South, they're much higher than the rest of the country. They're even higher than what we see in the Northeast and out in the West. So despite all these technological advances being made, our communities are still being disproportionately affected. We also, when you look at data, age data, you see that there are very high infection rates amongst young men in the 25 to 34-year-old age category, in particular men of color. So despite advances being made around, we have this thing called PrEP, which is pre-exposure prophylaxis. In certain communities is not being utilized or taken advantage of because of things like Cassandra mentioned, access to care, insurance coverage, and things along that nature. So we've made advances, but I want to be very clear that we still have a long way to go, and we still have communities that are being disproportionately affected for multitudes of reasons, which many of our panel members here represent, whether it be domestic violence, gun violence, whether it be housing issues, whether it be access to care. So I'm very, I always want to highlight that we've made advances, but advances for who? And I think we have to be very cognizant of that.
Right, thank you, thank you. Does any of the panelists want to reflect on that question?
Yeah, I'll just throw out a few comments. I think in the business of gun violence prevention, it's kind of a mixed bag, because you could look at the rates of gun homicides and suicides that have happened even just over the past year. There's been a substantial increase. The number of gun sales has skyrocketed. We're really working hard to try to get universal background checks passed in this Congress. And, we're very hopeful that will happen. We do see a shift in the conversation. We're starting to see more people talk about gun violence in ways that are positive for trying to make an impact on it. We see people talk about how proud they are of their F rating by the NRA or the gun lobby, as opposed to, years ago, people would brag about their A+ rating from the gun lobby. And I think this shift in the conversation is going to lead to good things happening at the national level. But at the state level in New Jersey, there's been an awful lot of work done to strengthen our gun laws in New Jersey. And we're right now probably second in the country for the strength of our gun laws. We're 47th in the country for the rate of gun deaths. But Blacks are 34 times more likely than whites to die from gun violence in New Jersey. And the national average is 10 times. So there is a disparity here in New Jersey that we still have to fight for. In fact, Governor Murphy laid out a whole list of things he wants done just a couple of hours ago, a brand new gun violence prevention package. But I think the biggest change I've seen lately is more focus on community-based violence interruption organizations. People who live in the urban settings where Blacks, Latinx people are living and experiencing this gun violence are working together in teams to try to educate and prevent the violence from occurring. And that's proven to be a very effective mechanism, and there's more money being put into that right now. So I think that's a real positive.
Yeah, thank you guys for sharing. And so from what I'm hearing, that there has been progress and we have made movements, but there's still work to do, which is why we're having this conversation. So thank you for sharing. Question number 2, which is kind of like a lead into from 1, is how can we educate the youth in the urban communities about public health?
I'll jump in again. I do believe that schools should be one of the top categories that we look at for education. When you have students and young adults basically in a captive audience setting, you have an opportunity to educate them because, again, they're there. They don't have any choice but to learn the subject matter at hand that's being taught in that school or at that time. So I think schools, resources, and kind of having doctors who look like some of these kids and speak the language that these kids do will definitely help. If they see themselves in doctors, it may even encourage them to want to be a doctor, or to at least care about their own health and awareness, and to get involved a little bit more. So I think school is a great place to start. And also at home parents, we have to also have some accountability. However, I think parents also need tools as well, because sometimes talking to your kids about certain topics can be difficult. So if there was a resource or maybe a tool that a parent could go to get some guidance, I think that that could help as well. So again, for me, I think it starts at home, but I think in school, when you have a adolescent or a young adult as a captive audience, we should be taking advantage of that as well.
I think we should all, oh, go ahead.
Oh, I'm sorry. I was going to say, I once again agree. And, I think we also have to start thinking a little bit differently about how we educate youth. Young people, and I know I'm sounding old now, but, they're incredible. And, they're kind of penchant for wanting change and wanting to be involved. We're seeing it now, record numbers from what happened over the summer. There's a lot of data and a lot of work looking at peer navigator systems and peer educators. And I think there's opportunity to take some of that work when it's more disease-based and turn it into kind of a public health educational framework, and how we can engage youth, train youth to educate in a peer-to-peer manner, because often youth take, the advice of other youth, right? They're not always going to listen to us. And I think it's an opportunity, as we're trying to rethink institutions and structures and different kind of systems that we have, is how can we activate youth to kind of educate other youth around some of these public health issues, how to make different kind of health choices, if you will, and how to be more kind of in charge of their bodies and some of the choices that they make.
The other thing is that we don't really have we need to start addressing social media and attracting kids through social media. That's where they are. And having positive promotions with kids on social media is a good place. TikTok, and instead of, how much water can you drink, maybe it should be some more positive things put out there so that kids hear good, positive information of things that they can do, and hopefully be engaged with.
I think Linda hit the nail right on the head as well. And through social media and sometimes through celebrities, I say it all the time. I can tell my daughter the same thing 50 times and she goes, yes, 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 yes. But if her favorite singer says the same thing that I said, she gets it from her favorite singer, but she didn't get it from me. And we said the same exact thing. So again, sometimes it's who the message comes from.
Questions on that question? Okay, so we'll move on. So domestic violence services have been funded historically through the criminal system. If we imagine moving money from a justice system approach to a healthcare model, what is on your wish list to prevent and treat family violence? The wish list. You can just put anything you want with that genie.
Well, if the domestic violence has guns involved, it certainly would be nice for people to be required to have training and get educated if they are purchasing a firearm. And there should be some test that you have to pass, just like you do if you get a driver's license. It would be great to have money put toward that. Would also be great to have low cost, safe gun storage options for people. If they could get subsidized somehow and, be able to get discounted rates on that if they have a reason to have a gun in the home. That's, again, if a domestic abuser has access to a gun, The women are 5 times more likely to die from gun violence in that situation. So protecting the home and any kind of harms that might happen to be in the home area is super important, and whatever funding we can find to help make that less dangerous situation would be great.
Great. Thank you for sharing that, Kathleen.
And I guess I'd say I'd like to see more money be invested in mental illness and mental health. I think sometimes in certain Black and Brown communities, it's not necessarily the most, I would say, something that most people don't want to come out and admit that they have a problem, or that they need to see a counselor, or that there's an issue that they need to talk about. So I think mental health is definitely where some of the money should be spent as well.
I think too, there's opportunity to address, who gets involved when domestic violence occurs, instead of, police officers being called out and et cetera, who's the right group, social workers, family, you know what I mean? In order to, someone who's really trained in, how do you kind of spot and how do you effectively, intervene in that cycle. I think too, and I'm speaking once again from a physician's perspective, we're not taught about that in medical school. We're not taught about how to spot domestic violence, how to talk to patients about domestic violence, to do an assessment, et cetera. So I think that there's, opportunity to, almost like we're talking about now with, racism as a public health issue, how do we overturn the entire system, from the ground up, and kind of re-envision or reimagine what the system could be and what we really want to see in the system.
Cross-educate. Yep. Yeah.
I think also investing in mental health services for men as well as women is needed because I obviously for women, because what they have gone through is a deep trauma, and there needs to be easily available services. And I've seen myself, not personally, but through other people, that it is not easily available, getting counseling or whatever that. All it has to do with how much insurance you have and what kind of income you have. And I think the same thing for men. If someone is a domestic abuser, there's a reason for that. And that needs to be caught and addressed early on before it becomes a problem. And I think very often we forget that.
And you know what, Linda, just to evolve your point or to piggyback off of it a little bit more, I think children should be involved as well, because sometimes they repeat the same cycle that they saw. So some men or women who are the aggressors, they may have seen it growing up. So all they're doing is repeating what they saw. So the children as well should be spoken to so they understand not to kind of repeat this cycle, that it's not appropriate.
Right. Thank you for that. So moving on to our next question, how has the conversation around vaccine hesitancy evolved or digressed?
That's a tough one.
Loaded, right?
Right. I mean, I think it's in the forefront because we're in the midst of a pandemic. I don't know if it has evolved or if it's regressed. I think it's a little different, this is my personal opinion once again. I think that there has to be a understanding of why certain communities have certain hesitancy around the healthcare system in general, and it's not just about, vaccine hesitancy. I think Dr. Brug said it eloquently at the beginning. What we're in the midst of now has shown light on systemic issues that have always been there. And I remember back in medical school, it was, this group has a worse health outcome, but never a delve into why, right? It's just attributed it to race. And I think we can't keep relying on historical anecdotes of it's Tuskegee, it's this, it's that. I think we really need to, and I'm not saying that those things don't contribute, don't get me wrong, but I think we also have to understand, what are some of the other issues around the healthcare system in general that causes people to have a reluctance with, participating within the system. And I think a part of it goes back to who's delivering care, who are we training to deliver care, what types of frank conversations with patients and other providers that we're having around the healthcare system and the delivery of care. And so I think it's much bigger than just this one topic, although this topic is very germane and extremely important right now. So I don't know if I have a discrete answer to whether it's, better, worse, or we're regressing. Yeah.
Dr. Baugh, I don't think that there's one set answer. I think it depends on who you talk to, when you talk to them. And I kind of say that using my own experience. 6 months ago, if you would have said to me, take the vaccine, I would have said, absolutely not. I'm not doing it. I don't think we know enough about it. Are they trying to put a microchip in my arm? All the other things that we have all heard. So I said, no, I wouldn't do it. I need to see the side effects from other people doing it. However, fast forward 6 months later, I would say my mom and all her siblings have had it. None of them have had an adverse effect. I have several girlfriends, other family members who have all had it. None of them have had an adverse effect, and they have all had all three of them. So this month I went in, and as I've been sitting here, I got the text for my second one. I went in this month, I had my first one. I had no adverse side effects. Next week I'll have my second one. However, with that being said, I think Johnson & Johnson set us back a little bit. When they put the pause on the medication, the one dose medication, I think for all the people who were skeptical, it gave them a reason to say, see, that's why we're skeptical. Look at Johnson & Johnson. And the people who were already okay with it, I think they're saying, well, it was a small percentage, so it's not a big deal. So again, I go back to my original response that I think it's an individual decision as to whether you think we've made some progress or whether you think we've digressed.
I think also it's about access. When I got my shot, I got it in a community of color, and I would say most of the people standing in line were white, be quite frank with you. But when we gave the shot here at the center, we had a pop-up vaccination clinic, and we just let people come right off the street. It was all people from the community here, and they were all willing. In fact, one person was walking by, and one of the directors said, hey, you want to get your shot? We're giving out shots. He got one right in line. I saw no hesitancy. Not to say that some people don't. I mean, I was a little nervous. But everybody, people were very glad to get it. And I think it's access. I think they've made it so hard. They're demanding IDs and insurance cards, which all, by the way, is not required. When we did it, we just filled out a form, and they got their shot and got their card. Now we did do Johnson & Johnson, so they were one and done, but I think it's access. I think people don't have access. They don't know where it's being given, and how to get it. Now, I think right now the city's done a good job in Elizabeth because they have robocalls going out to every phone number that's connected to the city of Elizabeth, residents. So they're really pushing it, and they're giving it out every day. But I think before there was no access, you have to make appointments. It just makes it too hard for people.
Thank you. I saw Dr. Brug come up. I don't know if she had a comment.
Oh, I just wanted to state that exactly right. We've been dealing in New Jersey in regards to vaccines and vaccination. The vaccine registration system that was put up was a barrier. We have now a vaccine disparity that exists. So while Blacks are 13% of the community in New Jersey, only 6% of us are vaccinated, while the Latinx community is 19%, only 9% of them are vaccinated. And it has to do with vaccine access. the study has been shown, and it just came out last month, across the races and ethnicities, it exists about 20 to 23% of vaccine hesitancy. And the majority of people who are vaccine hesitant actually happen to be white males. So therefore, the problem is we have to remove the barriers to the vaccines. If we can get education so people can make an informed decision, I think is essential. Have people can get their questions answered, and then give them access to the vaccine. That's where the importance lies in New Jersey.
Thank you for sharing that. We're going to switch. The next question is going to focus on women in particular. What grassroots groups are available for women of color to join to get support for ongoing experiences with racism?
It's interesting. When I first looked at it, I guess I didn't look at the grassroots part of it. I just looked at groups that were out there. And of course, one of the first ones that came to mind was the NAACP. Then, of course, the sororities, the AKAs, and the Deltas, they do a phenomenal job of mentoring young women and older women like myself through programs. So I think that's places where we could start at. And also the Women's Chambers of Commerce. That's a great organization that they strictly empower women, help women network together with different professionals. They also have mentoring opportunities. So I think that that's a great place. And I would be, again, remiss, I wrote this down. The doctor mentioned Believe Black Women. I think that that's a great opportunity as well for women to start looking at, and again, getting connected with as well.
Right, thank you. Does anyone else want to share anything on that?
I would just say that the Moms Demand Action organization, our primary goal is related to preventing gun violence, but there is a very strong tie between that and racism. And so, you know, the work that we're doing is definitely related to the root causes of gun violence, which are based in racial injustice. So it's a great opportunity if you would like to join the Moms group. It's not just women, it's people of all races, genders. It just happens to be called Moms Demand Action, but we welcome anyone who's interested in working against gun violence in a way that will impact ultimately racism as well.
Thank you.
Can I just make a comment that I think it's important I know we as Black people need to deal with racism, but I think it's important that the larger community actually deals with it themselves to have an impact, right? We are the victims as Black people of racism. What we need is for the community at large to accept that this is a problem and say, what can I do with myself? Oh, you want me to? Okay, so I'm sorry. What can I do within myself to address this basically public health problem as racism? But what can I do within my community? What can I do within my family? Right? It's a dinner table discussion, and work it that way. I think the onus is on that to occur in order for racism to actually dissipate in our society. But we do need to make our children, our Black and brown children, strong enough to deal with what is happening in society, because it's an everyday situation. And we see that in the healthcare system in regards to all the disorders and the diseases and et cetera. But we need to fortify them in order to be able to continue within society as we have it right now. Ask any Black man who's in the corporate world what their world is like, right? So we have to make sure our Black boys have the strength and have the tools to deal with this on a daily basis. So I think there are different aspects that need to be addressed.
Right, all the isms, right? Thank you for sharing that, Dr. Baugh. That's definitely a good point, that it's not only within the Black community, but those outside need to look at racism and understand what can they do to help eradicate it. So thank you for pulling that point out. The next question is, what can we do to support efforts to address this public health crisis of gun violence in America? Kathleen, I'm sure you're gonna want to.
Yes, this question was like written for me.
Right,
I
right.
appreciate that. So yeah, just to give everybody some scope here, every day more than 100 Americans are killed, shot and killed, and over 230 are wounded. And right now the US actually has more guns than it has people. So if guns meant a more safe community, then America would be 2.5 times safer than any other country. But instead, we are among the countries with the highest rates of gun deaths in the world. So the answer is not more guns to reduce gun violence. What can we do to support efforts to slow and stop this epidemic? One of the things that the Moms Demand Action Group focuses on is legislation and voting. And voting for candidates who feel the way that you do about gun violence prevention is so important. So number one, find out who those people are in your area. And number two, make sure that you vote. Secondly, I'm a big proponent of think globally, but act locally. So looking at where we are in New Jersey, we just talked about the fact that even though we have really strong gun laws, we still have a disproportionate impact on communities of color with respect to gun deaths. And we really need to work on that because most of our gun deaths are concentrated in our urban areas here in New Jersey. Half of the gun deaths in New Jersey occurred in 5 of our cities last year. So what Governor Murphy just talked about this morning is targeted towards addressing gun violence in urban communities to a large extent, and restricting the iron pipeline, as they say, which is guns coming in from other states that are used for gun crimes here in New Jersey. And we know that we have a gun sense, which means a government body that right now the majority is in favor of gun violence prevention. And we just heard about the CDC's guidelines coming out, which Dr. Brug already talked about. These kinds of decisions about impacting gun violence in a way that also addresses the disproportionate impact in communities of color needs to come from the top. And that's the Biden-Harris platform, and that's what the Biden-Harris administration has targeted all of their departments to go through all of their procedures and policies and determine what it is that they can do to address racism within these organizations. And I feel that there has to be this complete change in mindset in terms of where you start. You start at the top and you focus on that as your target, and you continue to drill down and down till you find the places where you're starting to make a difference. So again, continuing to express our desire to have a safer country free of gun violence through the ballot box is a really important tool that we have available to us to make a difference in this country.
Thank you, Kathleen,
Mhm.
for sharing that insight, and very important. And that goes back to show that the vote is very powerful, right? So that's why we want to ensure that we're voting even at the local level and all levels. When there's an opportunity to vote, exercise that right. Does anyone else want to share on that question?
I just want to comment, and this is a personal view. I think we have to really do some introspection as a country and a culture about why people want to have a gun and what does that mean, my having a gun. I mean, Pope John Paul II said that we were a culture of death. And I have to say, I agree with him. And I agree with it because there's like this need. Why do I need an AR-15? I don't hunt. And you sure don't hunt with one of those guns. I mean, why do we have weapons that are willing to kill? Why is it our police shoot to kill as opposed to just stop a person from running? Like if they have to shoot at all. Why is it that the human person is so disvalued that we're willing to do that? And I think that communities of color are affected by that more than any other community. And so, there has to be some reflection about how we value life. What does that mean? What does life mean in healthcare? Who's disposable? When we put up environmental, like these incinerators and pollute the air, where are we putting them? Where do people live? And what's acceptable? There has to be some reflection as why do I want a gun? And then that goes out further. And there's really something wrong that I am willing to kill somebody. And that's okay because I'm protecting myself. From what? When you really look at how much crime there is versus the number 350 million people in this country, I think crime is really lower than we realize, and that we're all not going to, need a gun to protect ourselves. And we don't have to blow a hole through their bodies in order to protect ourselves. And I agree with you, Kathleen, that people should have licenses and they should be insured. When they kill someone, they're going to be held accountable, just like when you have a car.
Thank you. And just additional insight, what are some of the proactive ways to engage in this public health issue? So for those who are listening, and what are some ways that they can become engaged?
I think it starts in the community. I think the local mom and pop shops, if you visit the same bagel shop every morning and grab your bagel and coffee, if they had flyers in the window, or if the person behind the counter said, you know what, down the street at the local YWCA, they're having a preventative community event, you should go. If they say it maybe twice, the person will probably consider doing it. Or in a local bodega, places that we know that the community visits a lot, they are some of the advocates that we should engage with us to try to get the word out versus saying, okay, let's just do it one off. But if we engage again, mom and pop shops and the businesses in the community, I think it goes further to get the word out to the public.
One of the things that I have been really thinking about is just the term or the word racism and what it triggers in people, and how do we disarm that word. And looking at Dr. Brug's slide, I think a lot of people have an idea of what that word means, but not taking into account kind of the systemic ingrained nature of the institutions that have led to all of this. And I think to Dr. Brug's point earlier, it really begins, and also to Cassandra's point, it's introspection, and it begins, within. But, it's interesting how just mentioning that word triggers and elicits such a response in different people, where there's the shutdown and then the conversation can't even move forward. So, I don't have an answer. It was just something I've been thinking about. a lot recently. It's how do we start to just move that conversation forward and disempower that word?
I think what Dr. Brug said earlier too is so important, whereas, you know, you can't say I'm not a racist and walk away from it and just say, all right, I've stated my position and now I'm done. You know, we all need to be anti-racists. You know, we need to not say I'm an anti-racist. You need to do things that indicate your willingness to combat this issue. You know, there is not a middle ground, as you said.
At all.
Right, right. And I think that's the next level of the conversation that we need to have. You need to get beyond the fact that people are saying, I'm not a racist, and say, okay, well, prove it. Let's see what you want to do. You know, there's this march going on, or here's this book I'd like you to read, or, you know, I read the book Cast, which, you know, been doing a lot of reading. Cast is an amazing book. And, you know, talking to my husband now and then about different things. And I said, in Cast, I read this, and he said, you know, maybe I should read that. I said, yes, you should. Put it on your nightstand, you know, and he's not a reader. So he's, you know, just talking to people about it and starting to use words that sound more familiar, and not, you know, not looking for a fight, just having a calm conversation. I think ultimately, as Linda, you said, we need to do a lot more introspective search within ourselves to get past this. Everyone does.
You know, not
Individual
to plug the book, but I read that book and it totally turned a light bulb on for me of how to really understand and look at racism, to the point where I then bought copies and sent it to people, not just the people who get it already, because then you're kind of preaching to the choir, but to those that I know who say just that. Well, I'm not a racist, it's not about me, but it's really taking a step back and understanding the institution and the kind of structural, you know, manifestations that, you know, and it's really unique to this country too, the structural racism that has occurred. And, you know, I know my friends were probably like, why are you sending me these books? But, you know, I found that to be one of the most powerful tools to open up dialogue amongst some of the people that I know.
Yeah.
Again, personal accountability is huge. If we all took personal accountability for our own behavior and we all lived appropriately, it would stop. And for the people who say, I'm not a racist, those are probably the biggest racists out there, because they don't even understand that they have some racist tendencies. And again, if you say, it's not me because it's not happening to me, well, you're part of the problem too, because if it's happening to one race or one ethnic background, it's happening to all of us, because we are all in the same community. So no longer is it, or should it be tolerated for people to say, well, it's not happening over here. If it's happening anywhere, it's happening everywhere.
That's right.
Thank you for that. Yeah, and I think, like you all have said, it's about having a conversation, right, and planting the seed. I mean, Kathleen, you planted the seed with your husband, having those conversations. So just continuing the conversations, you plant that seed, and that would invoke something in someone else when they hear it. So definitely worth continuing the conversation. It's about, we're close to time, so I'm going to allow you guys to just, if you want to say something maybe that you really didn't get an opportunity to share, we'll just go and let you guys share and be respectful of the time, because we're almost at our closing point. So Dr. Bryan, I'll give you an opportunity.
No, I mean, I just want to, once again, thank you for allowing me to be on this panel. It was extremely informative, you know, for me. And as a physician, I'm so happy that I got a chance to hear and meet or virtually meet Dr. Brug, and I'll be reaching out to her just because I'm fascinated with, you know, the work that she's doing, and in particular in maternal fetal health. And I think, you know, all of the panelists, I really appreciate the varying perspective and the viewpoints that were brought to some of these conversations, and learning about things like housing and, you know, access to insurance, and also gun violence, which are, all manifestations of different aspects of this thing called racism. So once again, I don't have really anything to add, but I want to thank you for allowing me to be a part of the panel.
Thank you. Linda Flores-Tober, you have any last comments that you would like to share?
Nothing particular, except for I felt that I've learned a lot myself, and that I think this is a wonderful forum, and that we need to do this more often, have these good conversations about the issue, and then, offer solutions that people can get involved in addressing the issue of the racism that is alive and well, thriving in our society, and we need to do what we can to end it. Thank you.
Kathleen?
It's the same thing. Thank you for having me. This has been a wonderful opportunity, and I just got to keep fighting.
And Sandy?
Again, thank you so much for allowing me to be a part of this distinguished panel. I also learned a lot today, and I am a proponent of preventive healthcare. Early detection is the key. So if you're under the sound of my voice today, please make sure you get an annual physical, you get checked out from head to toe. And if you are uninsured, again, another shameless plug for myself, please reach out to my company, Caring is Mutual, through either our website or the phone number or an email, and we'll be more than happy to help you get health coverage. And again, thank you so much for this opportunity. I greatly appreciate it.
Dr. Brug, do you have any last comments?
Yes, I think that everything starts from within. And I think in Union County, since we're dealing, there are a couple of opportunities. One I put already in the chat. Union County, through Social Justice Matters and the Martin Luther King Association, have race dialogues. Sign up for a race dialogue, and it gives you information in regards to race and racism. I think it's a great place to kind of start and get an understanding. There's also, and it's on Facebook, but it's Open My Eyes, which is basically dealing with certain subjects such as race and race relations. And we watch 13th, we watch, James Baldwin, I'm Not Your Negro, etc. In regards to watching a film and then having a discussion about it to further the conversation. It's on Facebook, it's Open My Eyes, and it's virtual, but it's a way that one can also have a source of different perspectives.
Thank you. Thank you, Dr. Brug, for the fabulous keynote. Thank you to all our panelists, Dr. Bryan, Linda, Sandy, and Kathleen. Thank you to all the attendees for your interest in this topic. This is just the beginning of the work to be done. And contact information for the attendees, for those on the panel, are put in the Zoom chat, and you can follow up. The email will be sent out soon as well. Enjoy the rest of your day, and remember to keep the conversation going, and collectively we can make a difference and continue to move forward. Thank you so much, and have a great afternoon.
Thank you.